My name is Shaeba Rizvi, and I have been involved in healthcare since 1992 in terms of education. The funny thing is that now we're learning a little more, but if you go back a few years, when you said, "What is physiotherapy?" they said, "Can you give me a massage? Give me a massage, please." Even though massage therapy is different, physiotherapy is different. When you talked about occupational therapy, they said, "Oh, can you help me find a job?" And occupational therapy is not about occupation as in a job. Occupation actually means anything you do to pass your time. So everything you do in 24 hours are your occupations, from sleeping to eating, feeding yourself, to grooming yourself, to changing your clothes, to exercising, to leisure activities, to your job, everything. So your entire life is involved in occupational therapy. I tell students when they're new and they're trying to understand that look at it this way. If somebody, for example, God forbid, is in a car accident, then they might have injured bones and muscles and nerves, etc., where now they're going through rehabilitation. Physiotherapy helps you to get to maximum functional capacity. And that means that whatever healing you do, and then after that, are you able to walk? Are you able to use your arms? Are you able to move? There might be permanent damage. So physiotherapy helps you get to maximum possible health and rehabilitation. But if there is lingering, permanent problems and disabilities that occur, special needs, then occupational therapy, with the use of their devices, will help to be still more functionally independent. So they work together in that way, but it's almost like the physiotherapy carries you to your maximum potential, then occupational therapy takes over and sees what they can do for you. And the whole goal in all of this is to have a good quality of life, because it's about healing and moving. So I tell them we're mechanics of the body. Your car mechanic keeps your car moving, we keep the human body moving. And movement is key to life. The other question they ask is perhaps what kinds of jobs can we get after this when we graduate? What can we expect? And I tell them that when you're on placement, learn about yourself a little bit. Because, you know, Socrates said, "Know thyself," and a lot of cultures and philosophies have realized that knowing who you are helps you to know what you like and dislike, and it helps you to know what kind of environment you would be happy working in. And I tell them that sure, you're in healthcare, you're in a secure field, you'll be able to make an income where you can meet your ends can meet and you can, have a good quality of life, but you want to put your head down on your pillow at the end of the day and be satisfied with what you did. That's what gets you waking up in the morning happy to go to work, not dragging yourself to work. So I tell them that when you're on placement, you will be placed in a long-term care facility or a retirement home. You will be placed in a private clinic. See the environments. And when you're in some environments, they're very relaxed. So some people, their personalities are such, they want a relaxed job. So they want a job where they go in, it's kind of routine, do some light exercises with the patients. Because in physiotherapy, we are doing many kinds of treatment. And when we do treatment, kind of like in a hospital, you have medical treatment, surgical treatment. In physiotherapy and occupational therapy, we have exercises and physical agents. These are our two avenues. Exercises are exercises, people know what they are, but we train and learn to exercise patients. It's different when you exercise a healthy person. Like you tell the healthy person, "All right, give me 10 push-ups, very good. Now run 10 laps. Now go do that bench press. Now go do some pull-ups." But it's a healthy person. They'll do as much as they can and they'll stop. With an injured person, your exercise is a treatment. It could end up being beneficial or it can end up harming them. So what happens is you have to know which exercises are beneficial, which are harmful, when to do what. So there's a science behind it. Besides the exercises, and our students learn lots of exercises. They learn strengthening exercises, stretching exercises, range of motion exercises. They learn balancing exercises, coordination exercises, endurance exercises. And also in physical agents, we use electric stimulation. So we have to, in class and then also on placement, they learn how to use electric stimulation, ultrasound therapy, heat therapy, cold therapy. They learn to use laser therapy. And these are all different agents that we use that help us to heal tissues. So with the physical agents that have no side effects, that's the beauty of it. Exercise has no side effects if done correctly. Physical agents have no side effects if done correctly. So that's the other added advantage of physio and why it's so highly recommended when it comes to patients who've had injuries, surgeries, any kind of musculoskeletal or nervous system problem. They need physiotherapy. You've had heart surgery, you need physiotherapy. Lung surgery, you need physiotherapy. Any orthopedic surgery, any nerve surgery, any muscle surgery, you need physiotherapy afterwards.